run people to get tested for HIV. We take them to the clinic if they need to go. Like if you're tested positive and you need ARVs, most people need to get a liver. They got to do blood work, which costs money. Then they go on the ARVs. We've actually, either tried to refer them to a place where they can't get the ARVs, or we pay for them ourselves. And then you need the nutrition to follow up. We've also had a young lady on our door, like she heard a talk given in the village by the United Nations about prevention of mother-to-child transmission. So you get tested, the mother takes nevirapine, you try to have a cesarean, and you really reduce the risk of prevention to the baby. But you can only breastfeed for 6 months, so they do that, and then there's no food follow-up, so they don't have the money to buy cereal after they stop nursing.
Or milk or anything.
So, they take all the steps, and so we see that, the NGOs have helped so far, but, there's a lot of need for follow-up.
This is something we really, really want to address.
When we talk, when people come, and if, we've paid for their ARVs, there's traditional medicine where they'll bloodlet with razors, which are usually infected. So we said, and the doctors say no African medicine, and we had a fellow work for us last year. Him and his wife, he got them on ARVs, and he was getting his legs slit. So we told him 4 times, if we find out that you're doing this, we're gonna not pay for the ARVs because there's somebody. So he kept doing it, so we stopped paying for his ARVs. There was no point. We tried to, we provided charcoal and nutrition, fish. We tried it, as much as we could to supplement his diet. So
moved him into a good house, painted it, set him up with blankets and everything, and he turned around and he just
kept slitting. So what he does is, and a lot of it is, if you are infected and if you have unprotected sex with your partner, then, it's like a double wham. It's like you're reinfecting yourself again. So your CD4 count, and, it's going to start plummeting. So, when we talk to people, we just say, if the mother needs to get tested for HIV because it won't show up in a baby till about 18 months. So we try to say, a lot of times we can't get the wife or the husband, or one of the partners won't go for testing. And we try to encourage them and talk to them, if you're going to have sex, you need to put on condoms, because you're just going to reinfect yourself, and you'll just plummet. And about condoms and having one wife, and all you can do, I guess, is just talk the message, and hopefully somebody catches on, and we'll do what and then you try to encourage and support them. But we have a fellow Wyson, his CD4 count right now is 60. He's on ARVs and Triimmune and nevirapine, and he hasn't told his wife and his baby that he's got HIV. The baby is how old, Jason?
Just 2 months old.
2 months old. So the wife could have, I'm sure she probably has HIV, and then the baby's probably, because he hasn't disclosed. And he's actually in the hospital right now. And he's stopped eating. He's already emaciated, so I'd say he's pretty much in the final stages of AIDS. He's got TB. But he hasn't told it. He won't disclose himself. But people know. They know what's going on, but you ask them, and it's like they died of malaria or TB. Well, those are usually symptoms that, especially TB, that, you are HIV or AIDS. You have full-blown AIDS, not HIV. Like, Wyson has full-blown AIDS.
And the symptom is that's taken.
Yeah, they usually die of opportunistic infections, whether it's TB or, malaria can